It was a looming problem before COVID came to town.
And then the pandemic made the nursing shortage even worse, with stress and staffing shortages forcing many nurses to leave the profession. The Bureau of Labor Statistics expects the nursing workforce in the country to grow by nearly 200,000 between 2021 and 2031.
In that same time, more than 2 million nurses are expected to retire or resign. That means we'll be left with 2.25 million nursing positions to fill. The American Association of Colleges of Nursing says nursing school enrollment is not growing fast enough to keep up.
We continue to have challenges with assuring safe staffing levels.
Now, that workforce shortage has forced another local hospital to make some changes. Altman Hospital is ending some services at Altman Woodlawn in Canton and at their hospice facility in Alliance, leaving some workers in limbo.
News 5's Bryn Caswell tells us a need for more employees actually led to that decision.
Well, it's always a difficult situation when you're closing services.
Altman Hospital submitted warn notices at the beginning of February, notifying Ohio Jobs and Family Services that 187 employees will be laid off in April. But Altman has almost 1,000 open positions, so not all of the affected people will actually lose their jobs. COO Ann Gunther says the majority are nursing jobs.
We have over 600 open positions. And so we were able to take those staff that was affected by the closure of our skilled nursing, and based on their interest as well as their skill level or their competency level, we were able to place 89% of that staff into open positions around Altman.
Now for the remaining 11% of employees left over. Gunther says those employees are still deciding whether they want to work for Altman or leave.
So if they choose to take one of those positions, certainly we welcome them. And if not, then certainly we will work with them to transition in the next 60 days.
Gunther says new care models are needed to ensure safe staffing because of the employee shortage. As a result, 2 locations are losing some services. They are Altman Woodland and Altman Alliance, but the hospital is planning to expand its Alliance location.
And over at Alliance, our inpatient hospice services will expand, but then we're also looking for additional opportunities for that space.
This highlights the need for area colleges that are getting caught in the middle of a high demand, yet what appears to also be a dying profession. The University of Akron School of Nursing says it's seen an 18% decline in enrollment.
It's causing a lot of trouble for the local hospitals to fill the staffing needs.
Kent State University says it's seen an overall decline in enrollment, not just in nursing, and students want more of a work-life balance.
These different generation of nurses that are coming at the bedside, they want that more Monday through Friday, 8 to 5, no weekends. They want holidays off, which is a stretch, which is a challenge for our clinical partners because the hospitals are open 24 hours.
Altman has adjusted wages this past year to help with turnover rates and new hire efforts. But low reimbursement versus the cost of care at facilities continues to burden an already stressed medical system. Maintaining patient care will remain an uphill battle as the number of patients isn't going down and jobs remain vacant.
We're incenting our own staff, to pick up additional hours safely to assure that we can meet those staffing standards that we know that our patients need in order to receive safe care.
Reporting in Canton, Bryn Caswell, News 5.
And we did check around with other local hospitals. Cleveland Clinic lists nearly 1,500 open positions for registered nurses in Ohio. University hospitals say they have more than 1,100 RN positions to fill.